Now let's continue with our discussion on the crashing neonate. We're going to start with our mnemonic, the Misfits. And we'll start with the letter T, which stands for trauma and abuse. Now this isn't a lecture talking about the management of trauma in infants. It's really the management of the crashing neonate. So we're not talking about patients who come in after a car crash or after a large fall or penetrating wounds or blunt injury. We're really talking about the infant who comes in maybe with altered mental status or vomiting or seizures, failure to thrive, or they're lethargic. So those are non-specific symptoms, but they're still worrying. And looking at the baby, you can't outwardly tell that this is trauma or abuse. And this is one of the hallmarks of shaken baby syndrome, that externally there's not much to see, but the kid does not look good. And this is one of the things that you cannot miss, because if you send this baby eventually back home to that environment, it might happen again. And you really have to have a high suspicion, because anybody can fall victim to this. Imagine that you are the parent of a new child, the child is not sleeping, and you're not sleeping, and the baby's just crying, and you have no idea why. And it's very easy to get frustrated, and it's very easy to just shake the baby. And it doesn't matter if you are rich or if you're poor, if you're young or you're older. Don't make any assumptions based on those demographics of the parent. It can happen. And maybe it's not even the parent. Maybe it's another caretaker, an uncle who is watching the kid, or a babysitter. So as the person shakes the baby back and forth, and don't get me wrong, this does require a lot of force. It's not just bouncing a baby up and down on your knee that this can happen. It's really hard shaking. Within the baby's skull, the brain is bouncing back and forth in there. And so what you get is intracranial hemorrhages. And this is the leading cause of death in non-accidental trauma. So you don't want to miss it, and the only way really to know this is to get a CT of the head. And I'd probably throw in a skeletal survey as well. I made an earlier video on the patterns of child abuse, fracture patterns of child abuse, which you might also want to refer to. Other things that you might see, perhaps you'll see a scalp hematoma. Maybe you'll feel some fullness of the fontanelle. Maybe expanding head circumference if you have the initial number and you measure it now. Though chances are you're not going to have that initial head circumference. But the thing you got to look for are retinal hemorrhages. And it's not subtle. I mean, if you can get at all a look in their eyes, you can see these spots everywhere. And one last thing you have to remember to do is to call your Child Protective Services or Department of Child and Protective Services to make a report. And of course this baby is being admitted. And you're going to do all the other things that we talked about, like getting an IV, get blood tests to get a CBC, coags, and you might want to get cultures and a glucose, and don't forget, of course, that head CT. So that's the first diagnosis in our crashing neonate in the Misfits, trauma and abuse.